Okay, so today I am going to demonstrate on how to shampoo a patient's hair in bed. So to begin with, so we have to knock on the door, okay, before you come into the patient's room, and then wash your hands properly. So by this time, I've already washed my hands. Okay, and then after this, we are going to introduce yourself to the patient and check the patient's name. So confirm it through her bracelet. So hi ma'am, my name is Chrisline and I'm your caregiver for today. So can I have your name please ma'am?
Dania,
Thank you. And when is your birthday please?
January 22.
Thank you. So after you verify or confirm your patient's identity, we are now going to explain the procedure to the patient. So ma'am, what I'm going to do for today is to shampoo your hair. So upon reading the doctor's order, it says there that it's okay to shampoo your hair already since you haven't had it for a couple of days now. Will that be alright for you ma'am?
Yes.
Thank you. Okay, so after we introduce ourselves to the patient, we have also confirmed that it's the right patient and then explain the procedure on what we are going to do for today. We are now going to fill the basin with warm water. So I have already filled it up here. So I have here a basin of warm water which we are going to use for the patient. Okay, and then after that, we are going to provide patient's privacy by, of course, shutting the curtains or the blinds in our case. So there you go. So if you're in a hospital setting, you'll have to shut the curtains before you do this procedure to your client. Okay, so now gathered my equipment here so as to save time. Okay, so I'm just gonna show you here the equipment that I have for this one. Okay, so we have here this basin, okay, which has warm water. I also have here a basin. This is what I'm going to use because I don't have the shampoo tray. Okay, and then we also have here shampoo and conditioner. Okay, a hairbrush. We have here a hairbrush, then a pitcher of water, and then we also have here bath towels, a washcloth, the gloves that we are going to use, and then cotton balls. Okay, so these are the equipment that we need in order to do this procedure. Okay, so after I've shown you here the equipment that is needed for this procedure, a very important thing is that, like what I've already mentioned earlier to the patient when I was trying to explain to her how this is going to be done or what are we going to do for today, check, okay, the doctor's order, okay, if there's any noted injuries. Okay, so now that I've already shown you the equipment that is going to be used for this procedure, we are now going to remove the pillow of the patient. So, ma'am, I'm just going to remove the pillow so that we can start our procedure. Okay, so after removing the pillow, we now put on our gloves to start our procedure. Okay, so now that we have already put or wear our gloves, what we are going to do next is to place a waterproof pad under the patient's head. So, ma'am, I'm just going to put off. So this is to protect the bed from getting wet while you're doing the procedure, okay? And then after that, you also have to check, especially if your patient is a girl, so you have to check if there are any pins or clips that's on the hair of the patient. One more important thing though is that you have to thoroughly check the head of the patient for any like wounds or any like injuries. that might be on the patient's head, especially if she's been lying down for a while. Okay, so for this one, I'm good to go because my patient is okay. So she doesn't have anything bad on her head that would be affected when we shampoo the hair. Alright, so after doing this, we are now going to place the shampoo board or basin for our case here. Because we don't have any shampoo board, so I'm just going to use the basin. Okay, so there you go. You can see it here. So there. Okay, so after doing this, we are now going to drape one towel so over the patient's shoulder. Okay, where the patient's neck sometimes would touch the board. So this is how you're gonna do it. So drape it over the patient's shoulder. Okay, so that's how you are going to do it. Okay, so after this one, we are now going to fold the top linen, which is this one. So we're going to fold the top linen. So fold the top linen back, and then so as to avoid it from getting wet, and then we put another bath towel across the patient's chest. So by doing this, we are avoiding any water splashing onto the patient. Okay, so I apologize, I have to sit down because the bed is too low, and so for the next step, we are going to put a washcloth over the patient's eyes. So ma'am, I'm just gonna put a washcloth over your eyes. Is that alright? Thank you. Okay, and then after this, we also need to put cotton balls into her ears. So mama, she's putting cotton balls here, just so water won't get into the ears. Always let the patient know what you're doing. So we don't want the patient to be surprised. So always tell her or him what you are going to do. Okay. So after this, so the patient is ready now for the hair shampooing. We have already placed the washcloth over the eyes and as well as the cotton balls in the ears. So now we have to brush the hair of the patient. Okay, so it will be easier for us to shampoo. And do it gently, especially if the patient has long hair. Alright, so after brushing the patient's hair, we are now ready to wet the hair thoroughly. So, ma'am, I'm just gonna pour water onto your hair now. So, typically, the pitcher that you are going to use for this has a handle. And then you just have to grasp it inside. Okay, but then for right now, I don't have any pitcher like that, so I'm just gonna use this. So you have to wet the patient's hair thoroughly. So we're using warm water for this. Okay, so we need to make sure that the hair of our patient is thoroughly wet. Okay, especially if the hair is long. Okay, and then after that, we can now apply the shampoo. So we have to apply enough amount of shampoo. So apply it onto your hands first, onto your palm. Okay, so don't pour the shampoo directly onto the patient's hair. And then rub it on your both palms, and then you start to lather it using your fingertips. So gently massage the hair. This is to remove the accumulated dirt and oil. the patient's hair. So apply more shampoo if needed. So since I have a patient with long hair here, I'm gonna need more shampoo for it. Is that okay, ma'am? Okay, so after shampooing the patient's hair, we can now rinse it using the warm water. So now I'm gonna pour water again on your hair. So we make sure that we rinse the hair thoroughly. Okay, so after rinsing our patient's hair, so always make sure that it's rinsed properly. We apply conditioner onto her hair, depending if it's desired by the patient. So, ma'am, would you like me to add or to put conditioner on your hair?
Yes.
Okay. So again, we put the conditioner onto our palm first. Okay, before we massage it onto the patient's hair. So just like what we did with the when we were applying the shampoo. Okay, so massage it gently. And apply more if needed. Okay, so now that we have already put conditioner onto the patient's hair, we are now going to rinse it again. So now I'm going to pour water again. Now you need to rinse the hair thoroughly. So the other purpose of the pitcher with the handle is that it won't slide on your hand when it's already slippery because of the shampoo or conditioner in your hand. So we don't want it spilling over the patient's face. Okay, so after we have already rinsed the hair from applying the conditioner onto the patient's hair, we can now dry the hair using a bath towel. So we remove this dry towel, and then we have here a towel to use for drying our patient's hair. Then we can already remove the basin. Okay, so after drying our patient's hair, also it is you can actually ask the patient if she wants it blow dried. So if there is an available blow dryer and the patient is okay with it, then you can do it as well, especially for patients with long and thick hair. Okay, so it can easily dry. So for this, after drying it, I'm now going to brush the patient's hair. So brush the hair gently. So brush it properly. Okay. And then after that, after brushing the patient's hair, we can actually now remove the washcloth, which is placed over her eyes. And then also the cotton balls in her ears. Okay. So after that, we can now ensure the client's comfort. Okay. So we we are going to remove the towel on her chest and put back the blanket or the top sheet. Okay. And then we can now put back the pillows. But so if ever the patient's hair is not yet completely dry, we can actually leave a towel. Okay, so then it doesn't wet the pillow and the bed as well. So ma'am, I'm just going to, you can sit up a bit. Okay, so if you need help, if ever the patient cannot move totally, then you would need another health personal's assistance to lift the patient up. Okay, so there. So, and inform the patient that you are going to, okay, come back after like about 15 minutes to take out this towel that is protecting the pillow from the patient's hair. So then you can now open again the curtains if you're in a hospital setting. Great. And then remove your gloves. Wash your hands properly. Gather your equipment that you have used for this procedure and then clean them and then put them back where you got them. Okay. And then so after doing all of that, wash your hands properly, and then after that you can now start documenting the procedure that was done. We are going to document the date and the time, okay, and the condition of the patient when we shampoo her hair. So it's important that we document everything that we did for the patient during that time. Okay. One more thing, you ask the patient if he or she still needs anything else, or if she's alright, she's comfortable enough, then you can leave and just go back again for the towel to take it out, okay, under her hair. So that's about it. That is my demonstration on how to shampoo a patient's hair while in bed. Okay, so thank you.